In Canada, each province and territory administers its own health card system, providing residents with access to publicly funded healthcare services. Here's an overview of the health card systems across different provinces and territories. 1. Ontario. OHIP. Ontario Health Insurance Plan. The card name is OHIP card. Eligibility requires residents living in Ontario for at least 153 days in a 12-month period. Coverage includes doctor visits, hospital stays, medical tests, and some specialist services. New residents must wait 3 months for coverage to start. 2. Quebec. RAMQ. Régie de l'Assurance Maladie du Québec. The card name is RAMQ card. Eligibility is for permanent residents of Quebec. Coverage includes hospital stays, doctor visits, dental services for children, and some medications. Newcomers must wait up to 3 months before coverage begins. 3. British Columbia. MSP, Medical Services Plan. The card name is BC Services Card. Eligibility requires residents living in BC for at least 6 months per year. Coverage includes doctor visits, surgeries, diagnostic tests, and some eye exams. Previously had monthly premiums, which are now removed. 4. Alberta. AHCIP, Alberta Healthcare Insurance Plan. The card name is Alberta Health Card. Eligibility requires residing in Alberta for at least 183 days per year. Coverage includes hospital visits, medical services, psychiatric care, and diagnostic tests. There are no premiums, and newcomers must register within 3 months. 5. Manitoba. Manitoba Health, Seniors and Active Living. The card name is Manitoba Health Card. Eligibility requires residents staying in Manitoba for 6 months per year. Coverage includes physician services, hospital care, and some dental oral surgery. There is no waiting period for newcomers from another Canadian province. 6. Saskatchewan, Saskatchewan. Health Card. The card name is Saskatchewan Health Services Card. Eligibility requires living in the province for at least 6 months per year. Coverage includes medical, hospital, and mental health services. Some dental and eye care services are included. 7. Nova Scotia. MSI, Medical Services Insurance Program. The card name is MSI Health Card. Eligibility requires residents living in Nova Scotia for 183 days per year. Coverage includes hospital services, physician services, and some dental surgery. New residents may have a 3-month waiting period. 8. New Brunswick. New Brunswick Medicare. The card name is New Brunswick Medicare Card. Eligibility requires residents living in New Brunswick for 6 months per year. Coverage includes doctor visits, hospital stays, and some dental oral surgery. Newcomers may have a 3-month waiting period. 9. Prince Edward Island, PEI Health Card. The card name is PEI Health Card. Eligibility requires living in PEI for at least 6 months per year. Coverage includes hospital visits, physician services, and limited dental and vision care. A waiting period applies for newcomers from outside Canada. 10. Newfoundland and Labrador, MCP, Medical Care Plan. The card name is MCP Health Card. Eligibility requires residents living in the province for at least 4 months per year. Coverage includes physician services, hospital care, and diagnostic tests. There is a 3-month waiting period for some new residents. 11. Yukon Healthcare Insurance Plan, YHCIP. The card name is Yukon Health Card. Eligibility requires residing in Yukon for at least 6 months per year. Coverage includes doctor visits, hospital services, and some medical travel costs. There is no waiting period for newcomers from another province. 12. Northwest Territories, NWT Healthcare Plan. The card name is NWT Health Card. Eligibility requires residents living in NWT for at least 6 months per year. Coverage includes physician visits, hospital services, and limited dental vision care. Coverage includes some medical travel benefits. 13. Nunavut Healthcare Plan. The card name is Nunavut Health Card. Eligibility requires residing in Nunavut for at least 6 months per year. Coverage includes physician services, hospital visits, and emergency medical travel. There is no waiting period for new residents from other Canadian provinces. All health cards provide free access to medically necessary services under the Canada Health Act. Not covered are prescription drugs, dental care, and vision care except in limited cases. Health cards are valid across Canada for emergency care, but you may need travel insurance for some non-emergency services outside your home province.